that we want to take a look at. Representative, take it away whenever you're ready.
All right. Thank you, Chair Aragona and members of the committee for allowing me to testify today. I want to begin by sharing a story of a young man from Sault Ste. Marie named Dakota. He was a father, a son, and a brother with a bright future ahead of him. On August 26, 2023, he made a decision that would tragically change his life forever. He made a simple purchase at a convenience store, and hours later he was found deceased. The coroner ruled his death as mitogyronine intoxication caused by a dangerous synthetic drug known to most as gas station heroin. Dakota believed he was buying a natural supplement called kratom. Kratom is a plant native to Southeast Asia and has been used in the United States safely since the 1970s, often for pain management or relief from depression. Our veterans use this for PTSD. But what Dakota purchased wasn't pure kratom. It was a synthetic product marketed as kratom, but laced with a powerful substance called 7-OH, or gas station heroin. This compound is up to 13 times more potent than morphine. Yet in Michigan, it can still be purchased legally. 12-year-olds can go buy this. They manufacture it with flavorings such as bubblegum and mix it into candies to attract users like children. This is unacceptable. My bill will ban the sale of these dangerous synthetic chemicals and prevent them from being marketed as kratom. It would also establish strict regulations for the sale of natural kratom itself. Under this legislation, kratom could only be sold to individuals 21 and older, and all retail stores would be required to keep it locked in display, and it would not be allowed to print on packaging misleading information such as healthy alternative, weight loss supplement, energy. They would no longer be able to put that on the packaging. Because of synthetics, drugs like 7-OH, Dakota's child will grow up without a father, all because of something he legally purchased that any of us can purchase. Our children can purchase this at any convenience store that sells it. Thank you for your time, and I open this up to any questions.
Thank you, Representative. And just to be clear, there is a natural product of kratom, and then there's also some synthetic versions. And in your bill, you want to make that distinction?
Correct. Yes.
Okay. And then you said 21 or older. Is that correct for
Yes,
purchasing?
correct.
And then what would be the penalty for anybody who would be selling to a minor? Would it be similar to cigarettes or?
Yeah, it'd be licensing, a violation of licensing law.
Gotcha. Okay. All right. Any questions? Representative Fairbairn.
Thanks for the testimony on this, Representative Cavett. This one hits home as Dakota was from Sault Ste. Marie in my district, and this is something we need to look at very seriously. I'm very grateful for you taking this legislation up. Thank you.
Thank you, Representative.
Representative Regas.
Thank you, Mr. Chair. Thank you, Representative Cavett, for your testimony. So we were learning a lot about this rather quickly. This just kind of came up very recently. So the natural kratom leaf, when traditionally consumed and studied clinically, has that ever shown to produce the same dependency or toxicity profile as concentrated or synthetic?
That's a very valid question, Rep. Regas. Thank you. Kratom produces a minute level of 7-OH, and one of the things that they do is they take the kratom and they spin it and extract the 7-OH and then put it back into it synthetically. So they take a minute trace that's produced in the kratom and make a compound that makes it 12 times as strong. This stuff's stronger than morphine, and people are having trouble with addictions on it.
He doesn't know.
To get off of this, you would need professional assistance, most likely, or you're going to have a rough road.
So, but you don't have the same side effects with the natural product?
No.
Okay. Okay, thank you.
Yes.
Representative Linting.
Thank you, Chair Aragona. And thank you, Rep. Cabot, for your testimony.
Yes, ma'am.
So would it be possible for a drug manufacturer or whoever's making this substance to make a pill that's basically 80% 7-OH, 20% kratom, or 90% 7-OH?
There's no regulations, Rep. They could
Okay.
do what they want. It's an unregulated industry right now. That's why we're trying to get a little control on this.
Yeah.
You don't know what you're getting. There's no serving sizes. So if you and I were going to go out and enjoy some kratom, we wouldn't even know how much to take.
Right.
We
Okay,
could
thank
take.
you.
Well, most likely we'd probably take too much.
Yeah. Thank you.
Any, Representative Regas?
One more question. What are the benefits of the natural kratom? I spoke with a woman before a committee
Yep.
who's here.
Many
She
many
mentioned
use this product
fibromyalgia.
safely to help with anxiety. A lot of people in the recovering community use it to help wean themselves off of stronger drugs,
Okay.
such as heroin and morphine. And our veterans use it primarily for PTSD. So
Okay.
this product can be done safely. Kratom alone, it's the synthetics that they're adding to it that people don't necessarily know because the packaging doesn't necessarily tell you. You know, they add flavorings, they put them in drinks, powders, and primarily what's riled me up a little bit to pay some attention is they market it towards children.
But it does have natural benefits, just as cannabis does.
Correct.
For different ailments. Okay, thank you. Okay, I'm done officially.
Thank you, Representative Regas. Any further questions? Representative Nyer?
Thank you, Chair. Do we have what's considered a safe or acceptable level of the 7-OH in there or proposed level?
Yeah, I believe it's at 2% is an acceptable level. But again, you will not find what's an acceptable level on the packaging. It's all very misleading.
Any further questions? Thank you, Representative.
Thank you, Chair. Thank you, Committee.
Next up, we're going to have John Cleveland from Heart Holistic Alternative. Wishes to speak, opposes the bill.
Chairman Argona, members of the committee. My name is John Cleveland, here on behalf of Holistic Alternative Recovery Trust, or HART. I'm testifying in opposition to HB 4969 as written, and you all should have a folder in front of you with much of the information I'm about to touch on. By way of background, I am a former legislative aide to U.S. Senator Lindsey Graham and served for 5 years as Director of Policy and External Communications for South Carolina Governor Henry McMaster. In that capacity, I worked within government to address the Palmetto State's own opioid crisis, including efforts to limit the overprescription of opioids and resulting addiction issues. After leaving government, I worked within the highly regulated cannabis industry, mostly in California, to expand cannabis marketplaces safely, responsibly, and legally. Today, I represent kratom and 7-hydroxymetragenine, or 7-OH, manufacturers and retailers through HART. So as not to bury the lead, we want you to regulate kratom, but we also want to be part of that regulated market. By the end of today, you'll have heard a lot about the benefits of the Kratom Consumer Protection Act. You also likely hear and have already heard a lot of scapegoating of 7-OH products, which this legislation would ban. It is part of a deliberate, considered, and strategic effort by some kratom manufacturers to ensure their own survival. It's the age-old sacrificial lamb maneuver. And it's why you're suddenly hearing so much about this novel, largely harmless alkaloid. This is an intra-industry fight. You may hear today that 7-OH is purely synthetic, that it's somehow more addictive and harmful than kratom leaf. That could not be further from the truth. First of all, kratom and 7-OH are one and the same. It is present in the natural plant in very small amounts, yes, but when you ingest kratom's primary compound, metragenine, it is then converted by the body into 7-hydroxymetragenine at a rate of 24%. So it's not a designer drug. It's not something being snuck into smoke shops. It's what your liver, your body's most vital filter, converts kratom into after you ingest it. That's not my opinion. That's fact. Like traditional kratom leaf, 7-OH products act as a partial agonist at the mu opioid receptor. Because it's a partial agonist, it has a ceiling effect. If you take more, you don't feel more effects. It's also for this reason that 7-OH demonstrates very low beta arrestin recruitment, which is what causes respiratory depression and leads to overdoses. You just heard that isolated 7-OH is more potent than morphine. People who say this are conflating high potency with intrinsic efficacy. In a vacuum, yeah, this is a potent substance. So are many, traditional kratom products that this legislation would allow. But potency does not define how a compound works within your body. Again, as a partial agonist, 7-OH only partially activates the body's opioid receptors, limiting its effects. It's the reason that, over the past 3 months since the FDA made an announcement about 7-OH, no one has been able to point to a single confirmed death from 7-OH, that 7-OH alkaloid consumed in isolation. The fact is, over 1 million people in the United States have consumed over 1 billion servings of 7-OH. And after more than 1 billion servings consumed, there have only been 40 reported adverse health events. Hundreds fewer than soap, tens of thousands fewer than Tylenol, with no confirmed deaths stemming from 7-OH used in isolation. That's according to the FDA's own database. Kratom leaf, meanwhile, has more than 1,400 adverse health events on that same database, with more than 700 associated deaths. Again, kratom leaf is what would be legalized by this legislation. So let me be clear, we don't believe either 7-OH or kratom should be banned. In virtually every case I've seen, kratom-associated deaths have involved polydrug combinations. But allowing kratom sales while banning 7-OH is not rational from a policymaking perspective. You may know that this is Secretary Kennedy's position, and while we have great respect for RFK, we do disagree with him on this point. So why not just ban it all? Just say we don't want this in Michigan, let's get rid of it. The answer is the cat's already out of the bag. Millions of Americans, including presumably hundreds of thousands of Michigan residents, use these products safely and responsibly. Turning off the tap will only drive markets underground or drive consumers who employ 7-OH for recovery back to the street drugs from which they're trying to escape. Moreover, if 7-OH is banned and kratom remains legal, chemists will only generate new variations of these products, variations we know very little about, leading to an endless game of enforcement whack-a-mole. So what should you do? You already know the answer, responsible regulation. At heart, we are actually asking for regulation. We want dosage limits of 25 milligrams per serving. We want age restrictions so that no one under 21 can purchase these products. We want age gating in stores, requirements for child-proof blister seal packaging. We would like uniform enforceable adherence to current good manufacturing practices for dietary supplements and food facility and safety requirements under the Food Safety Modernization Act. We would like third-party testing. We want clear labeling, including appropriate evidence-based and consumer-tested product warnings and precautions. We want requirements that all marketing claims are truthful and substantiated in accordance with the FTC's truth in advertising requirements. And we want ongoing oversight, including independent toxicology research with publicly shared results. This is an evidence-driven path forward, focused on health, not fear, not profit. It means that government will not be in the position of choosing winning and losing alkaloids within the same plant, and it will ensure that adult consumers can make their own free and informed choices about their own health. For many of them, especially those with chronic pain who don't want to be on traditional opioids, it will ensure they can maintain a better quality of life. The average 7-OH consumer is not a teenager, it's an adult woman in her 40s living with chronic pain. 75% of self-reporting consumers use 7-OH for pain management. Many others use it to combat opioid use disorder and withdrawal symptoms. This includes parents, patients, veterans, white and blue-collar workers. Do not take away their lifeline. Listen to their stories. Listen to leading researchers from Johns Hopkins, Harvard, and UCLA who stress that 7-OH should not be considered a public health crisis, that available data show no evidence of overdose deaths, respiratory depression, or widespread dependence. Listen to experts from Doctors for Drug Policy Reform, Cato, Reason, the Consumer Choice Center, the Taxpayers Protection Alliance, the Grunt Style Foundation, a great veterans group, all of whom think that a ban is wrong and counterproductive. Most importantly, listen to consumers like Rob from Macomb County, who said, 7-OH is not a high or recreational escape. It is a means of survival and quality of life. For many people like me, it's the difference between being confined by pain and anxiety or being able to function, work, and contribute to our communities. Restricting or scheduling this compound would harm countless Michiganders who rely on it responsibly for both physical and mental relief. Please consider the real human impact of this compound. It is not an abstract issue. It's about people like me who have found a way to live again, thanks to 7-OH. I urge you to protect access for those who depend on it for pain control, anxiety relief, and overall well-being. I'll close there. Thanks for your time. I urge you to remove provisions in this bill banning 7-OH and incorporate these products into a broader, considered regulatory framework. Happy to answer any questions.
Questions, Representative Fairbairn?
All right, well, this one winds me up a little bit, so forgive me, but
Understood.
would you acknowledge that the natural leaf kratom and the synthetic 7-OH are two completely different substances?
7-OH again is present in the kratom plant.
0.04% of the.
Well, and it becomes more and more as it oxidizes, right? So, to say that it's a synthetic product, I mean, is vitamin C synthetic? It doesn't have 12 oranges in it, but, again, it's very much an alkaloid present in the kratom plant.
But they've got two different pharmacology characteristics, the natural leaf and 7-OH. I mean, there needs to be some separation here. You guys can't market it as kratom when you're extracting one part of the natural leaf and
Yeah.
calling it's a different product.
Totally agree with any kind of marketing restrictions you see fit. Absolutely. But again, yeah, it's one of 50 alkaloids within the kratom plant. Many of those, I mean, I challenge anyone to tell me what every single one of those 50 alkaloids in the kratom leaf plant actually do. But we know what this one does.
Rep. Tisdale?
Thank you, Chair. So 7-OH attaches to the part of the brain that controls the cardiopulmonary system functions.
I'm not a scientist. I know that it partially attaches to the opioid receptors in the brain.
Okay,
Much like-
and opioid attaches to the cardiopulmonary functions. That's how people overdose,
Right. It does not.
as does alcohol.
Right. It does not implicate the beta arrestin pathways to the same degree as a traditional, what you think of as a traditional opioid like a Vicodin or a Percocet.
And so you said in your testimony there's no known overdose. There's no known
There is no
dose that would result in fatality.
in a study in mice. There was no LD50 level found for a lethal dose level found for 7-OH. That's right.
Okay. Thank you.
Yes, sir.
Rep. Thompson?
Thank you, Mr. Chair. Thank you for your testimony. A lot of my colleagues have asked the questions that I was going to ask, but just sitting here trying to explore the difference, the question that was asked by Rep. Fairbairn was the different pharmacology between the natural kratom leaf and the 7-OH. And you were argumentative on the fact that there are 50 different alkaloids in the leaf. Not everyone knows what they do, but you know what this one does. We talked about the receptor in the brain, the mu receptor that these agonists attach to. So just doing a quick chat GPT search. And I mean, we're all using it, right?
Absolutely.
And it talks about receptor activity. It says that the leaf is a partial weak mu agonist, but then it says that the 7-OH is a strong mu agonist receptor. It talks about the natural concentration, euphoric, sedative potential, addictive potential, overdose, and respiratory depression risks. With the leaf relatively low when pure and unadulterated, with 7-OH significantly higher, same mechanism as a traditional opioid. The metabolic pathway, lethal dose range, and then saying and making a statement in the paperwork saying that there's no deaths associated to it. There's multiple reports that you can find from Los Angeles, Minnesota, California, where the only product in that person was 7-OH. There
We
wasn't
actually-
alcohol, there wasn't marijuana, there
We
was
have the
nothing
coroner's
else.
reports. In the Los Angeles case, at least, that's the one I know about. There was alcohol in all of those cases. I'd be happy to.
Yeah,
share those
because
with you if that's
then
allowed.
I know ChatGPT can be wrong.
Once in a while.
But it absolutely says was the single link in this article.
It does, yeah. There's a lot of misinformation out there. Again, I would point you to the FDA's database.
So if you regulate it and you put how much is in it, how do you keep it away? Because I saw some members in the audience when they talked about children are able to get this at the gas station. And I just see a couple people shaking their head no. Are children allowed to get this at a gas station or not?
All of it, kratom products, 7-OH products, all of it, the whole gamut. It's unregulated. So
So
a lot of products.
right now, all the products on that list that you showed the pictures of, wherever that is. Anyway, children or, teenagers that may look of age, they can go into the grocery or to the gas stations right now and purchase any one of these without being carded.
Kratom leaf products are generally self-regulated, just as 7-OH products are. So it would typically say on the box 21 and up. But again, there's no teeth behind that, right? We need regulation of Kratom leaf products and 7-OH products. We fully support that. And honestly, I think we would support a ban on 7-OH product sales in any establishment where anyone under 21 is permitted to enter.
I think it would do better in advocating for something that has
Rep.
high
Thompson,
risk.
I'm sorry, we're running short on time.
Okay.
I got to move on if that's okay.
Okay, that's okay.
Rep.
Go ahead.
Whitwer.
Thank you.
Thanks, Chair. I just wanted to know what other states, or if there are other states that have kratom regulations, if they allow 7-OH to be sold.
So a good example is my home state of South Carolina. I live in Boston, but home state of South Carolina, they also were considering this very legislation, the Kratom Consumer Protection Act. And we had these similar conversations with them, and they just removed the provision that we would also like to see removed, which is the 2% cap on 7-OH.
Thank you. We're going to cut off questions there. We're going to move on to Mac Maddow from the American Kratom Association. Come up and testify, wishes to speak in support of the bill.
Mr. Chairman, members of the committee, my name is Mac Haddow. I'm the Senior Fellow on Public Policy with the American Kratom Association. We represent the more than 24 million consumers of natural kratom leaf products in the United States. And I'm grateful for this opportunity. 45 years ago, I sat as a state legislator in hearings like this, and I wanted to assess the credibility of the witnesses that were testifying. And I'm going to test the limits of that by telling you two things. One is the consumers in the United States of natural kratom raw leaf products want appropriate regulations. We want these products to be tested prior to introduction into the market. We want them to be properly labeled. We want the formulations in the products to be limited, both in terms of the concentrations or extract products and 7-OH products. And finally, we want age gating. We think that's an important part of it. The second thing I want to tell you is that there is bipartisan support for these regulations, even at the federal level and in the U.S. Congress. And everybody believes nobody agrees on a bipartisan basis for much in Washington, D.C. But I can tell you that the federal Kratom Consumer Protection Act has as its principal co-sponsors at the House level Congressman Jack Bergman from Michigan and Congressman Mark Pocan from Wisconsin, two diverse political camps who are advocating for this. And on the Senate side, Senator Mike Lee of Utah and Congressman Cory Booker of New Jersey. Again, very diverse political bedfellows in this issue. In 2016, when the fight was on to preserve market access for kratom, it was Bernie Sanders from the state of Vermont and Orrin Hatch from Utah who fought to make sure that kratom remained legal, and this was prior to the FDA's now having a more informed understanding about kratom when they were attempting to restrict it. But I can tell you that the Food and Drug Administration today has come to an understanding about the safety profile of natural kratom leaf products. For years, they were anti-kratom, but in 2023, they conducted a human dose finding study on natural kratom leaf products. And they determined that when they got to an enormous dose in a 5-minute period, 12 grams of kratom. Traditionally, people don't take that level of kratom in any dose, and they got to that level, and the only thing that was experienced was nausea, 12 grams in a 5-minute period, and the placebo group experienced the same nausea. So any amount of that plant material in that period of time is going to cause that. So the FDA's conclusion, published today, is that kratom appears to be well tolerated at all dose levels. It was a safety study, and now there is a grant that has been given for a study on the human abuse potential study. You can, Representative, become dependent on kratom. You can. It is different. It is night and day different than being addicted to an opioid. Dependency that you experience with nicotine and with caffeine, that's the kind of profile that we're talking about with a kratom dependency. The FDA was ordered to appear in a federal court in the Southern District of San Diego to determine and testify with documents and experts as to whether kratom was dangerous or not, and they refused and told the judge in an official communication, we, the FDA, have not yet determined whether kratom is dangerous or not. That's an important fact finding, and you compare that to what happened.
Sir, if
on
you can
July-
wrap it up in the next couple of seconds, I do have a few people I also need to get through. Thank you.
Thank you. July 29th, 2025, the HHS Secretary and the FDA Commissioner announced that they were recommending for scheduling 7-hydroxymitragynine as a Schedule I substance. I, in my more than 45 years in the U.S., working in Washington, have never seen the HHS Secretary and the FDA Commissioner make that recommendation publicly, and they did so. And you can go to the FDA and 7OH webpage, and you will see the reasons why. It is dangerous, and that is why we recommend today that Michigan should join the 18 states that have passed the Kratom Consumer Protection Act. The only one that didn't do 7H, only one was South Carolina, as a previous witness mentioned, and they're committed to do it this year. So this is what we need to do in Michigan. We hope you'll follow suit. Thank you very much.
Thank you, sir. And I do have one other speaker, Walker Gelman from Global Kratom Coalition. I believe you traveled quite far, sir, so why don't you come up if you can take about 2 minutes, and that would be great. Wish to speak in support of the bill.
Thank you. My name is Walker Gallman, Legislative Director of the Global Kratom Coalition, an alliance of consumers, scientific experts, and industry leaders seeking to enact regulations to ensure consumers have access to safe and regulated natural kratom leaf products. The GKC strongly supports the passage of HB 4969, which creates a comprehensive regulatory regime for kratom products in Michigan in order to protect consumers. The bill includes vital provisions such as a labeling standard, age restrictions, the creation of a product registry, a licensing program, product testing, and prohibitions on synthetic products. Across the country, numerous states have advanced similar kratom regulations that have ultimately gone on to ensure a safe market for kratom consumers. Natural kratom leaf is a botanical from Southeast Asia with centuries of safe traditional use that's grown in popularity in recent years. Today, 23.9 million people in the U.S. and roughly 700,000 people in Michigan report consuming natural kratom leaf for its functional benefits. Due to the widespread use of natural kratom leaf, its safety profile is backed by centuries of safe traditional use, with at least 50 years of use in the United States, and decades of science supporting its safety, including an FDA clinical trial in 2024, which showed natural kratom leaf is tolerable in humans, even in servings up to 6 times that which is commonly consumed in the U.S. As the science on natural kratom has advanced, it has become overwhelmingly clear consumers should not be prevented from accessing this natural botanical. However, we need to also acknowledge that not all kratom is equal, and in fact, not all products that call themselves kratom actually are. Due to the current absence of state regulations, dangerous concentrated synthetic opioid products like concentrated 7-OH are now masquerading as natural kratom while marketing themselves as drugs. Concentrated synthetic 7-OH products bear absolutely no resemblance to the natural leaf kratom products that are used by millions of Americans today. For context, natural 7-OH is an oxidative byproduct compound found in trace amounts in dried kratom leaf. However, concentrated synthetic 7-OH products contain more than 100 times more synthetically created 7-OH than what is found in natural kratom leaf.
Walker, if you can wrap it up in about 20 seconds.
Yes, I will skip ahead. That's why HB 4969 makes a clear distinction between natural leaf kratom and concentrated synthetic 7-OH products. Furthermore, the bill aligns with the FDA's stance on this matter, as my colleague Matt Caddo said about their recent announcement on scheduling. So in closing, one thing I touch on. However, despite having no laws on kratom in Michigan, MDARD has recently begun removing kratom products from convenience store shelves, hurting small businesses and consumers who rely on natural leaf kratom. These actions are misguided and run counter to the recent action taken by the federal government. It is imperative that the legislature move quickly to rectify the situation by passing HB 4969 and ensure Michigan consumers can continue to have access to safe natural kratom products.
Thank you, Walker. Appreciate it. I do want to read in a couple of cards. Andrew Kulpa from the Botanical for Better Health wishes to speak. I'm sorry I don't have time for you in support of the bill. Derek Sova opposes the bill as written, so we'll be working with the Cannabis Regulatory Agency on that. And I do want to make special note and apologize to David and Melody Wolf. Are you guys here? You guys in the back. This just says Michigan resident users. Mostly in committees we have associations and groups coming up, but you guys are just Michigan residents, and I'm very sorry we didn't get to you. But I do thank you for being in the Regulatory Reform Committee. You do support the bill as written, so thank you very much for being here. Seeing no other business before the committee, I do want to excuse absent members. Yes, I do. Representative Devendorf moves to excuse absent members without objection, so ordered. And Representative Hoadley moves to adjourn without objection, so ordered.
Wow.
That's
All
it?
right.
Well, okay.
All right.
That sucks. We want to see the testimonies.
Yeah. I think, I mean, it was like a rush.
Yeah.
Like they were like, all right, just go.
Yeah.
Except for the heart, dude.
Except for the heart, dude. I mean, props for getting up there and advocating for your substance, but your substance is not
Yeah.
my substance. Stop trying to frame it as it being the same. Just because
Or it's like, it's the same until you want to like restrict or regulate it to a certain percentage, and then you just want to take it all down under the bus.
Right.
You know what I'm saying? Like it's the same until I don't know. It's just you can't.
I get so sick of hearing that argument. Well, when you take your kratom, you're getting 7-OH. Yeah, duh, naturally.
Yeah.
Along with the other alkaloids. And like McCurdy always says, it's a symphony orchestra. So
Well, and think about how much of a difference. So you're talking about like that'd be like somebody was like, "Man, I wish I had the money to buy a car." And they're like, "You got plenty of money, dude." And you have 1 penny.
yeah.
And then you know what I'm saying? It's like money is it's like such a different I don't know how to explain it, but it's like it's not the same amount. You're talking about astronomical
Mhm.
levels compared to what's in the leaf or what our body converts.
Yeah.
Plus, you got chemicals thrown in there. So you got residual, solvents, contaminants. No
This
telling
one
what else.
analogy that I saw on, I forgot whose TikTok video it was. I think it was Jordan's or something like that. Where they said you can't get drunk off of grapes. It has to
Yeah.
go through a process for you to get drunk off of it.
Yeah, I feel bad that she's up there and she couldn't speak.
Right. I know, Laura.
I'm glad that she didn't have to sit there all damn day.
Right.
Because, I would have felt really bad. She done sat all there all day.
Because we were sitting on this hearing for probably, 45 minutes, an hour before they
Yeah.
finally got to the kratom part. I don't know. So they want to be able to sell 25 milligram tablets. So, from my understanding is the 2% limit would make it a 1 milligram tablet. If I understood that correctly. But they want to be able to start off people on 25 milligram tablets. It all started off with 15 milligram tablets. And even then you were supposed to break those in half or quarters or whatever. Now there's
Yeah, I think that even the dude that takes it himself, what's it? He said, what, don't go above 8 milligrams in a day?
Yeah. And we've seen the 200 milligram tablets,
Yeah.
This is just fast cash money grabs.
It's crazy. So I guess they'll figure out something behind closed doors.
I don't know what's next, honestly. Yeah, Mike, but yeah.
Yeah.
Cocoa leaf versus cocaine comparison. Yep. I would love to try the cocoa leaf, even though I was, had a 6 weeks run-in with the cocaine with the white girl, I think it would be vastly different versus drinking the cocoa leaf. Laura says, what got me is when he agreed that kids can get it, but it's self-regulating. Yeah, I know. I mean, what happened to the 2-year-old? She took that half tab in Georgia. She overdosed and they had to use Narcan at that daycare center.
I don't know. And then the whole, mouse study.
Oh, yeah.
Wasn't that about natural occurring 7-O?
That was naturally occurring. And that's what they use. They use that study to make their semi-synthetic products.
That's what gets me. It's like you keep using the wrong science. But these legislators have no idea.
Yeah.
You know what I'm saying? They're not gonna. I mean, dude, I get it. They don't have it. the time and all that stuff to go and look into it. But it's like, I think that's what bothers me the most about all these hearings is people can get up and say whatever they want to, and it's, it just bothers
There's
me.
no way to fact check it.
I mean, she used what, ChatGPT.
Yeah.
Dude, I've been wanting to try some. Dude, Dr. McCurdy said he'd shoot a coca leaf and he like went hiking up a mountain.
Yeah. Yeah.
I'm like, dude, that's what I need because the fatigue is rough some days. I'll take me some coca leaves.
Do you have to get off here?
Yeah.
Oh,
What
okay.
to do?
I was gonna say, you want to show the new interview with Dr. McCurdy?
I wouldn't mind, but that's like 2 hours.
Yeah.
That's like 2 hours.
Man, that was fast. That was fast. But I wanted to see the testimonies.
Yeah, I did too. I guess Melody and her husband were the only two up there.
Interesting.
I still would have hated to come, like, get ready and go all the way up to a courthouse.
Yeah, I don't know how far it is away from her. But we know Mac had to travel there, and then the guy from the GKC traveled there.
Hopefully it's worth it. I know that's right.
Oh,
Dude, if it would have been an
God. That was brutal.
yeah, that was bad.
That was brutal. So, we've kind of learned from watching those other hearings that we will go live as soon as they get to the kratom topic.
Yeah. Yeah. Well, and then he had to drive 8 hours or 2 hours to get there.
Yeah.
Oh man, did you see those chairs? Like, I can't imagine sitting in those chairs. My back would be hurting.
I know.
Like, somebody just take me away.
Like, put some cushions in those chairs. You could rip a master fart in those, though. Those wood chairs. Okay, well, I guess we'll end this. Damn, man. I want to see the testimonies.
Yeah.
It's the whole point of why we live stream these.
But at least we know what happened, you know?
Yeah. I don't know what's next. I don't know. But they
I'm
were
sure
kind
Matt will
of
update us.
like going after the heart dude. So it seemed to me like some of the reps were educated on this.
Yeah. I don't know who that dude was that I guess was introducing it or whatever in the beginning.
That was the guy that we were asking people to send their emails to.
Oh, okay. You're so good with that stuff, dude. That's why I'm always glad when you tell me who it was.
Yeah, he's the sponsor. Yeah, we know, Laura. There'll be a next time.
Yep.
Freaking, this month of October has just been slammed with hearings behind the scenes. Like, there's
Yeah.
stuff we don't even live stream or record. Well, no, we'll record it, but some of them will record. But yeah, this month of October, we've attended more hearings this October than we have all year.
It's just crazy because it's usually kind of quiet this time of the year.
Yeah. But because of 7OH, and I know people don't want to believe us or believe me,
Yeah.
but because of 7OH, that's why we're having to do it. Normally, we're normally only busy from like January to June, July, something like that.
Yeah.
And then we have the rest of the
Sometimes
time
all
of
the
the
way
year
up
to kick
till
back.
September because I think,
Yeah.
some of us, I know my state closes in September.
Yeah.
This was the Michigan KCPA hearing
Yeah.
that happened. It was really quick,
Really quick.
but no
Damn it, Laura.
decision. I know.
Yeah, I know, Mike. I know. Next year is going to be brutal, too.
Oh, yay. Maybe we'll get a break for December for Christmas.
Oh,
That'll be our
man.
Christmas present.
I know.
Oh.
I feel like I don't know. I feel like maybe 75 hearings that we've done all year. You know, and it
Yeah.
really, I don't know, the number might be higher or lower. I don't know. Laura's got the deets on that, the details on that. But especially when I came back from Champs in July, that's when everything picked up. I was like, oh man, what? What?
She's just meaning like a busy month for
Locality hearings.
advocacy.
Yeah.
Yeah, different hearings going on. They're popping up like crazy.
Yeah.
But I mean, that's like you say. I mean, I know that people don't want to believe that 708, but I mean, dude, it's
It's the sole reason why.
it's like if anybody that's advocated in the past 2 years could see a change, an uptick in it.
Yep. And the uptick has been insane.
All right, well, I guess we're gonna get off here, but we'll be around. Everybody have a good Halloween.
Yes, be safe.
Halloween Eve. Yeah.
Be safe.
Dude, I hate how they redid the restream because I keep trying to go to the wrong thing. All right, I found it.
Till next time, everybody.
Bye, everybody.